here at Mary Washington Healthcare, our goal is to treat patients who are sick, but when we're talking about health, there's other needs that come into play. And so I think the benefit of kind of using the partnerships that we have in the community is that we can support our patients with their other needs that are not, directly like illness based.
It's flipped the system on its head. Going on 20 years of working in this very complex system of helping people, the problems citizens face are hard enough. Navigating agencies and nonprofits and all the people who are tasked to help them is nearly impossible. But what this new workflow has allowed us to do is to take the onus and the responsibility on ourselves and hopefully lessen the burden of the customer. Someone already in crisis doesn't need an extra weight to carry. So with our new workflow through an online platform, we no longer have to hand them a brochure with possibly outdated contact information. Rather, we make the referral, we make the contact. We reach out to that community partner with the click of a button.
So often it does feel like there are so many different agencies and so many different things that they might need that it's overwhelming to them and they simply don't know where to start. And so for us, United Virginia allows us to give them all those resources, right? We can submit them for every single bit of resources that they need, rather than having to say, okay, well, I happen to know Jonathan at DSS and he might be able to have something about rental assistance, and well, there might be something out over here. We can put it all into one place, and then the organizations and those partnerships can pull from that to reach out to that individual.
So when I received the referral from Mary Washington, I quickly called the lady, the elderly lady, and she was like, I didn't know that there was so much help in the community. So I started asking her what her needs were. She was saying that she needed help with food. So I kind of was talking to her about Love Thy Neighbor, Fredericksburg Food Bank. She initially told me, she was like, hey, I got help from Fredericksburg Food Bank right before I left. And then I have an appointment with Love Thy Neighbor tomorrow. So with the whole community thing coming together, and for her being elderly, she was ecstatic. She was like, wow, all these people are reaching out to me just to help me.
I'm very honored. I'm very happy that I can make someone's day, push through another week, letting them know that they're cared about. More importantly, they have food as well. If they ever need to fall back on something, I was able to give them a call and they were able to express their emotions. Sometimes it's not just about food. Throughout a 60-second phone call, you could probably hear emotions, stress, and any other things. And I was glad that because of Unite Us, we were able to throw all sorts of alternatives, all sorts of solutions to a family to keep on pushing.